Okay, so we're going to kick off this webinar now. Welcome everybody to this stroke community webinar. My name's Catherine. I'm a nurse and a researcher at the Centre for Community Driven Research. My nursing area is rare, genetic and complex conditions, but my career actually started off in the stroke ward at Concord Hospital in Sydney. So CCDR is a charity that works to understand the experience of patients in the health system, and we work to empower patient communities, raise awareness, identify gaps in care, and also generate evidence for advocacy. We have people joining us today from Australia, Europe, and the UK, so very warm welcome to everybody, and especially a very warm welcome to those joining us who are living life after a stroke and family members present as well. We've got a wonderful audience, 85 people registered to learn more about the experience of people who've had a stroke, which is so good to see. So we welcome all the clinicians and researchers joining us as well, people from industry, and of course our friends from the Stroke Foundation. For those that are watching the recording of this session at a later date, welcome to you. And those watching on YouTube at the moment, you're also very welcome. We have some nurses in the audience today, so a very happy International Nurses Day to everybody out there. But before we kick off, some housekeeping. If you have any comments or questions along the way, you can use the comments or the Q&A. I won't be able to see your comments if you're on YouTube link, but we might be able to get back to those separately later. I have put in the comment section the link to YouTube, just in case you have any trouble with Zoom. You can pop over to YouTube and watch it because it's being streamed live. So following the presentation of the Peak Stroke Study, Lisa Murphy from the Stroke Foundation will be talking about some of the great work that's happening in the community. So let's kick off with the presentation of the study. Okay, so this study in stroke was made possible by generous arm's length funding from IPSEN Australia. We can't do any of our work without the support of funders like this. As all the participants in the study would know, the studies we do are independent, so it means that no one has any influence on the way we ask questions or the way they're reported. Before we kick off, and thanks to the Stroke Foundation for this information, you'll see it also in the chat function here. Sometimes when you hear about experience of other people with stroke, it can bring up questions or some anxiety. So if you need any support after the presentation, there's some links for services at the Stroke Foundation and also Lifeline in case you might need them. So what I'm going to do today, Peak studies, they're large studies. They're holistic, and they dig deep into the experience of people with different conditions. So what I'm going to do today is help you navigate the study so you can go back and read them yourself and dive into the different areas that might be of interest to you. So the study is presented on a dashboard, so you can go through and look at the different subject matter areas that you might be most interested in. For the patients out there, what I would say is this is also a great tool. It's a bit of a peer-to-peer support tool where you can go and see what other people have experienced and how they've dealt with the different challenges that they might have come across. In section 1, we have, this is where you can read about the methodology of the Peak study and how we approach recruitment and all of those kind of things, if that's something that's interesting to you. What I'd like to point out is that this particular stroke study is one of the largest that's happened in Australia in terms of people that have actually been interviewed. So thanks so much to everyone who put their hand up to participate. You've really been part of something special. We had 107 people participate in this study, 89 people that have had a stroke and 18 carers. And we've also pulled out a special report that we'll put on our website soon that's just about the experience of carers. So we've separated the two out a little bit as well so that we can see how carers are also coping with the impact of stroke. So we've had a range of people from across Australia participate. and some nice balance between people coming from the city and from regional remote areas and different education experience of work as well. Had a few more women than men put up their hand to participate in this study, but we're very grateful for everyone that did so. We collected 96 hours of interviews, and for each participant we spoke to you for about 54 minutes. So that tells us there's a lot of deep information that we collected along the way. Now, when you're going through the study, you'll see that we always separate out the results in terms of what might be some subgroups. So if you're ever looking at the results and think, oh, I wonder if it's different for men or women or by age or different things like that, you'll always see the results so you can see where there might be differences in different demographics. At the beginning of the study, we asked you all about your baseline health. So this is the amount of energy and how you're able to physically function. So some of the results that came through there for this particular cohort was that feeling of fatigue, feeling tired most of the time, and not having a lot of energy. When we go into section 3, this is all about symptoms and diagnosis. So there were 2 lots of questions that we asked. We first asked the online question about what were all of the symptoms that you might have experienced. So you can see some of that lack of coordination, trouble walking, being confused. So those are things that came up as symptoms that you might have experienced before diagnosis. But then we also asked a question in the structured interview about what was it that actually you recall leading right up to the diagnosis. So some of those things were more around having headaches, speech disturbances, visual problems as well. So as you go through the study, and this is particularly important for the patients and carers out there, you'll be able to read quotes from other people that have experienced stroke. And this is really where you start to get a sense of what's happening with other people. You might relate to some of those quotes as you see them come up on screen or through the study itself. We asked a question about how people were diagnosed, what was that pathway, and not surprisingly, most people were diagnosed under urgent medical care within a hospital, ambulance setting or community setting. We also asked the question, and this is a really important one particularly for us clinicians to remember, is what people's understanding of their condition was at diagnosis. So just over 40% of people said that they had a limited understanding, a bit over 30% said they had no understanding at all. And for us in the health system, it's important for us to remember it might be something we work on every day, but when someone's newly diagnosed or it's just happened to them, it's all very new, so we need to take it slowly in terms of how we communicate that information to them, particularly when at that diagnostic point. A similar question, and this is one that isn't often asked in the clinic, is what is your understanding of prognosis or your future outlook? So just over 50% of people said that the discussion really wasn't mentioned, but they still had quite a clear understanding of what it meant for them. Another really important question for us to remember as healthcare professionals, to make sure that these conversations are had so that patients can know what might be ahead of them in the future. Here's some more results from that same question in terms of what people actually understood. So most people understood about their prognosis that it was had a long-term impact and that they would need to keep managing those symptoms throughout probably the rest of their life. In section 4, this is where we ask people about decision making, how they come to make decisions and what's important for them. And I should mention too, I'm really just pulling out some of the results here. There are a lot more results in the study, but today is just about giving you a bit of a flavour of what the main results coming through, and particularly from those structured interviews where we have those quotes and those testimonials from patients about what their experience has been. So one of the questions that we ask is, when you were diagnosed, just after you had a stroke, what were some of the discussions that you were able to have about treatments? So just under half of the people in this study spoke about having multiple treatments proposed to them. Some people, about a quarter of the people in the study, said they were really only given one treatment. And not surprisingly and understandably, some people weren't able to exactly remember what those discussions were. This is an important question because we need to understand what those conversations have been, so that if there are challenges in what patients can access, we know whether it's because they weren't offered specific treatments or rehabilitation, and we can trace back to see where the genesis of those issues might be. Some of the specific treatments that were discussed at diagnosis were around rehabilitation, surgery, and then some of those treatments like aspirin and blood thinners as well. An important question. After stroke, it's a long journey. So we ask a question about, has your decision-making changed over time from when you first had a stroke up to now? So most people, over 60%, said, yeah, it did change over time. And some of those reasons were because they felt they became more assertive. They were more aware of their own health responsibilities, was another key theme within that question. So this is an important one for organisations supporting people with stroke to understand, people change over time, the way they make decisions change over time, and also important for health professionals to remember that as well. For those people that felt that they didn't change their way they make decisions over time, some of the reasons for that was because they'd always felt like they'd been an assertive person. Another really important question, particularly in the context of stroke, is what are your personal goals for treatment or care? So hopefully this is a question that has been asked to patients and families about what they want to achieve in their treatment and management. So most people, just under a third, were saying physical improvements are really important to them, or maintaining their current condition so that they're not going to get worse. One thing that popped up, and this is a common theme in different parts of the study, was that ability to work and ability to return to work, and also that impact of not being able to work because of stroke. That's something that's come up quite a few times within this study. Section 5 is about treatments, quite a big part of the study. Just so you know, when you go back to the study, you'll be able to see all the different treatment types that people have been able to access, their quality of life, their understanding of how effective those treatments have been. I won't go through that today, but you can go back and have a look at that if that's something that you're interested in. One really important question we ask is whether people felt like they were treated with respect in the health system throughout their experience. So overall, most people felt that they were treated with respect, maybe sometimes with one or two exceptional occasions, but overall had a good experience in terms of being treated with respect. Here's some of that information I was talking about, this theme that kept popping up throughout the study about impact on income and the ability to work. So you'll see throughout the study that we ask a lot about costs and impact on costs for patients and their family. We ask about it, diagnosis, treatment, and overall. And some of those things, some of the evidence coming through is not for everyone, but for a reasonably significant proportion of the population, at least a quarter to a third, we're seeing there is some burden in terms of out-of-pocket costs. And some of this relates to work status, so not being able to work, or having a family member that's had to change their work habits as well to accommodate for some of maybe the disabilities or extra care that the person who's had the stroke needs. Here's some data that has been collected on what kind of allied health patients have been able to access. We've got lots of speech therapy, physio and OT, psychologists as well. So this is one of those questions that might be triggering some questions in the patients and carers out there about, what should I be accessing? What have I, what I've not been able to access? So these are good questions to take back to your GP or whoever's your main clinician, your main treating clinician, just to have a think about, is there anything else in allied health that maybe might be good for me now? People also reporting some diet and lifestyle changes. So the most common change following having a stroke was an increase in uptake of exercise. Complementary therapy. So this is where we've asked people what kind of complementary therapies they've been able to access. So some people taking up massage therapy, and mindfulness and relaxation is one that people reported that they really valued and were able to take up as a complementary therapy. And this might not be prescribed or guided, but themselves taking it up. And this is something we've seen quite commonly across a lot of the different studies that we do, is people taking more on board the mindfulness and relaxation that they can do themselves at home. Clinical trials are important for lots of reasons. In this particular cohort, there weren't many people that had a conversation about clinical trials, and a few that had brought it up themselves. This is really important. A lot of people in the sector talk about trying to advocate for more trials being available. This is how new treatments become available to the community. But always keep in mind too that there's also clinical trials that aren't just for treatment. There's clinical trials around allied health, physiotherapy, occupational therapy, and all those different supportive services that you might be interested in as well. And they can really bring some benefit if you're eligible for those trials. Now, a couple of questions that we ask again, really important, is understanding what do patients understand as a mild side effect or a severe side effect. Really important for healthcare professionals to take on board some of this feedback to know, if I, for example, as a nurse say, it might just be a mild side effect, that might not mean the same thing to a patient. So for patients, in terms of what they would describe as a mild side effect, it's mostly something that doesn't interfere with their everyday life, so they can manage it themselves. Some people give examples of these as well. Some of those were around fatigue and maybe a little bit of nausea, things like those. In terms of severe side effects, the description patients gave was if it impacted their everyday life and their ability to conduct their everyday activities. Being bedridden, causing long-term damage were also things that popped up. So here are some of those descriptions of how a patient might describe a mild side effect. What's interesting when you look through the study too is you can have things like fatigue that can be counted as both a mild and severe side effect. So it's really important, and why it's important to speak to patients is to understand what language they're using so we can adapt the way we respond as clinicians to their side effects and symptoms. Adherence to treatment. So this is where we ask people about how long they generally stick to a treatment when it's prescribed. So very compliant group of people here, taking on the advice of specialists as they prescribed and not giving up on treatments were the main themes coming through, and sticking to it as long as it's tolerable and as long as it's working. Another really, really important question that we ask the participants is around, what do you think needs to change? What do you need to feel to know that a treatment might be working? So overall, people want that quality of life, improvement in their general well-being, and generally for their specific symptoms to be reduced, or also what we saw, some of the theme coming through were they want to know that they can prevent future stroke as well. So some of those specific symptoms that people wanted to be able to see, to know treatment is working, is the cognitive and mental symptoms, and also the muscle weakness and discomfort. So for people in this study, that's what was important to them. A few more sections to go, and then I'll hand over to Lisa. The next section is around communication and information, so how people experience communication and how they accessed information. This is a bit of a busy slide, but one I like to show so you can go back and see where some of the gaps in information are. So there's all different ways to present this. The way we ask the questions is that, first of all, we ask the participants what information they've been able to access, and then we ask them, what did you still have to search for? So this is a great one for anyone that is in the business of developing patient information. You can see where people are really trying to find more information, where they've had enough information, where there might be some gaps as well. Partners in Health. So this is a scale that's been validated. It's a validated tool. And what it does is measure how well a patient cohort understands their condition and can use knowledge to help support their care. So on average, this particular group had excellent overall knowledge, coping and confidence in managing their health. So I think we can thank Stroke Foundation and the clinicians in the community for their education role they play, this particular cohort having such a strong understanding of their condition. Information that's been helpful to patients. So a very strong thing that came through is that peer-to-peer support. So that's been really important for this particular community, the stroke community, and also the health charities have played such a big role in the information that's been helpful to them. What's not helpful is the patients actually, and this is reflected in that previous result, where the patients had a good score of knowledge, is that they were quite confident in deciding themselves and they didn't really find anything that wasn't not helpful, being able to figure out for themselves what is relevant to them and what's not. Some of the things that in the lesser themes that came through are sources that aren't credible or not evidence-based, or things that are too general and not really specific to them, their particular condition. Overall, the people in this study felt that online information was their preference combined with talking to someone. So this is a very common theme that comes through all the studies we do, is that mixture of being able to access information online, but still really highlighting the importance of being able to talk to somebody. So those combinations are always really important to remember. The reason that people have some of those preferences is in information, being able to access it online, the accessibility, being able to digest things at their own pace, and then being able to talk to people to have time to ask those questions was also valued. Timing of information, so not everybody's ready to take up information at the very start at diagnosis. Some people, about a fifth of the people were ready at diagnosis, 15% so they were just ready to take on information continuously, but some people needed a little bit of time just after the shock and waiting till they got home from hospital to really be able to take that information in. Overall health professional communication has been overall positive, and this was reflected earlier in the way people felt they were respected as well. So this is all very good to hear. Where it is positive, where communication is positive, some of those characteristics are where it's a two-way communication, where it's holistic and a supportive conversation. Where it hasn't been positive, it's where people have felt that they were dismissed and it might have been more of a one-way conversation. Care and support. So this is a care coordination scale. So it measures how well people have been able to navigate the health system. So for this particular cohort, that they had overall had a moderate experience of care coordination. So there might be some more work to do in helping patients navigate the health system. Overall, people felt that there was over 60% of people that they felt that they didn't quite have enough rehabilitation, that they would like a little bit more, which is an extremely important result for this stroke study. Quality of life, another very strong result of this study. So just over 60% of people felt that overall that having a stroke negative impact on quality of life. There's lots of reasons for this, but what we show in the study is also that holistic view of quality of life, mental health, impact on relationships and families as well. And that's all in this part of the study in this section 8. So some of those negative impacts were the emotional strain, not only on the patient, but the family as well, and the changes in relationships. So that was the strongest theme that came through, was around more the impact on the family and those relationships in terms of quality of life. Another really strong result, just over 90% of people spoke about having a negative impact on mental health. That's a really big result to think about in a patient population, just how much impact, while the physical impact is incredibly important, this is telling us that the emotional and mental impact is just as important. Some of the regular activities people take up to help them with their mental health is consulting health professionals, using coping strategies such as social, lifestyle changes and hobbies, physical activities as well. Impact on relationships, again, another quite strong result, that there was just under half of the patients in this study said that they did have a negative impact on relationships. So this is a theme that's popped up a little bit throughout the study, is that change in dynamics, change in relationship roles, perhaps not being able to participate quite as much as they want to in family life, in family activities and events. So here's some of those deeper results on the impact on relationships. As I said, the dynamics of relationships, families and friends not quite understanding the condition that's changed the way relationships form and are kept, and also that's distancing from social activities that can create some isolation within patients and their families. Was there a burden on families from as a result of stroke? So a little bit even in terms of people that felt there was and that there wasn't a burden on family, and that sometimes delved down into people that were a bit further along and didn't feel like they had a burden now, but maybe did at the beginning when they first had the stroke. Overall, just under 70% of the participants felt like there was at least some cost burden associated with having a stroke. So this is another thing that we need to consider in the results of this study, is how the financial impact of stroke might impact a patient or the family. Some of those cost considerations, and again, this is that theme that keeps popping up, is the need to have time off work for themselves or also from their family members as well. Cost burden for specialist treatments can add up, and some treatment costs as well can add up. Section 9, so once we get to this point in the study, we've asked patients and their families about their experience, and now we say, well, you're the experts, what should we do next? So some of the expectations for future treatments that might be available were that they're more affordable and more effective. But people also want to know what's available. So that's an important message for us as healthcare professionals and patient groups, to make sure that we're educating patients on what's available to them now and what's coming through clinical trials as well. What are people grateful for? So we obviously have a really good health system in Australia. Healthcare staff, people were incredibly grateful for, and in general, the entire health system. That access to free and low cost medical care was also really appreciated. This is one of the last questions we ask in the study, and what we say is, if you were standing in front of the health minister, what would the message be about stroke? What's the most important thing for the minister to know? So the most common thing was to improve access to support and care. A little bit more support and care out there in the community. More specialist stroke services for people to access, and better access to treatment and holistic treatments was another important theme that came through. In section 10, we ask about advice to people in the future. Another really great question that we ask is what do you wish you'd known earlier? So This comes back, if you remember at the start of the study, a presentation here, we're talking about understanding of prognosis and outcomes and what's next. So one thing that patients say they wish they'd known was what to expect in the future, what to expect as they go forward. They would have liked to know more early signs and symptoms and have more awareness. That goes along that line of prevention and how we can prevent stroke in the future. Section 11, I'm just putting this slide up so you know you can go back. In this section, it's a discussion of the results that we have from this study, but it's also a bit of a literature review on where we're at in stroke in Australia at the moment. So if it's something of interest, it's a section you can go back to just have a little bit of a read of where the evidence is at in terms of different aspects of stroke treatment and care. So finally, in section 12, we look at all of the results of the study, and we have a look to see, if there were 3 things that we could do for this patient population that would help them in their quality of life, what would they be? So in terms of information, we think that probably more personalised information would be great, particularly about treatments and rehabilitation, and also breaking that information down into different demographics that might be a bit more detailed and in-depth. More support in terms of routine provision of case managers to follow up with patients. That was one of those results we saw, is that ability to access rehabilitation and be followed up. So to ensure that people have that holistic treatment and care plan and access to the treatments and allied health support that's available. And of course, that important point of making sure that patients have the opportunity to set their own personal goals. And finally, in terms of quality of life, access to stroke-specific mental health and emotional health. So this might change over time, but it should be able to cover a range of issues that we've seen patients talk about in terms of fatigue, emotional distress, mood, problems with cognitive problems, thinking, memory and judgment. So that really holistic emotional care plan for patients as well.